Greeting everyone. Atopic dermatitis introduction. Atopic dermatitis is the most common chronic inflammatory skin disease and its increasing prevalence presents a major public health problem worldwide. Characteristic features of AD include pruritus and a chronic or chronically relapsing course, usually beginning during infancy, early onset, but occasionally first developing in adulthood, late onset. AD is a complex genetic disease and is often accompanied by other atopic disorders such as allergic rhinoconjunctivitis, asthma, food allergies, and less often, eosinophilic esophagitis. These conditions may appear simultaneously or develop in succession. AD and food allergy had a predilection for infant or young children, while asthma favor older children, and rhinoconjunctivitis predominate in adolescents. This age-dependent sequence, referred to as atopic march, represents one of many potential pathways to atopic morbidity in children with AD. Given that atopic disease usually starts with AD, management should not be concentrated solely on the treatment of acute flares, but also be directed toward ameliorating the underlying genetically determined epidermal barrier dysfunction and preventing active dermatitis via maintenance therapy. Definition: the association of AD with allergic rhinitis and asthma were recognized by Besnier in 1892. The term atopy originates from the Greek word atopos, meaning the strange or unusual, was first applied to the triad in the 1920s, including the use of atopic eczema. A decade later, Hill and Sonberger proposed the name atopic dermatitis. The list of characteristic features proposed by Hanifin and Raska in 1980 helped to unify the clinical concept of AD. 1994, William and co-workers simplified Hanifin and Raska criteria to establish the UK Working Party diagnosis criteria for AD, which were validated for the purpose of clinical study. The criteria, modified slightly by William in 2005. In 2003, a consensus conference spearheaded by the American Academy of Dermatology suggested revised Hanifin and Raska criteria that are more streamlined and applicable to the full range of patient ages, according to the consensus nomenclature by the World Allergy Organization. The term atopy is tightly linked to the presence of allergen-specific IgE antibodies in the serum, as documented by positive fluorescent enzyme immunoassay, reversely RAS test, or skin prick test. Thus, an IgE-associated or allergic form of dermatitis, formerly known as extrinsic AD, corresponds to AD in the strict sense. The remaining 20 to 30% of patients with the clinical phenotype of AD who have no evidence of IgE sensitization or categorized as having a non-IgE-associated or non-allergic form of dermatitis, formerly known as intrinsic AD. However, IgE-associated allergic to AD and non-IgE-associated non-allergic dermatitis have substantial overlap and cannot be considered as two separate diseases. For example, the latter often represent an early transitional form of IgE-associated AD. Epidemiology: the current prevalence of AD in most high-income and some low-income countries is approximately 10 to 30% in children and 2 to 10% in adults. This represents a 2 to 3-fold increase over the past several decades. In general, the prevalence of AD in rural areas and some low-income countries is significantly lower than in their urban and high-income counterparts. More recently, however, the prevalence of AD appears to be plateauing. in many high-income countries, where there tend to be an inverse socio-economic gradient in prevalence. The pattern illustrates the importance of lifestyle and environment in the pathogenesis of atopic disease. Although it is clear that the incidence of AD peak in infancy and chronic disease is frequently observed, the clinical expression over time vary considerably. Recognized AD trajectory include transient, relapsing, remitting, and chronic persistent disease. Predictors of persistent into adulthood include a young age at onset, concurrent asthma, and/or allergic renal conjunctivitis, low socio-economic status, non-white ethnicity, and phylaxis mutation. However, it is unclear if these predictors are independent of disease severity. Three subsets of AD based on the age of onset have been described based on epidemiology study. Early onset AD defined as AD beginning in the first few years of life. This is the most common type of AD, which develops during the first few months of life in 45% of affected individuals, during the first year of life in 60%, and before 5 years of age in 85%. Approximately half of children with disease onset during the first few years of life develop allergen-specific IgE antibodies by 2 years of age. About 60% of infants and young children with AD go into remission by 12 years of age, including a rapid resolution by 4 to 6 years of age, while in all the disease activity persists into adolescence and adulthood. Late onset AD defines as AD that starts after puberty. There are few epidemiological studies on AD with an onset in adulthood. Approximately 30% of AD patients overall are in the non-IgE associated category, and among adults, the vast majority of such patients are women. AD in the elderly, a subset of AD that begins after 60 years of age.